There's nothing more important than your health, and there's nothing more private than your healthcare information. Imagine all of the personal information your healthcare provider has about you, like identifying details such as your home address and tax ID, and even more sensitive information like your age, weight, medical conditions, and what prescription drugs you're taking. This is exactly the kind of information that is valued by bad actors on the internet. Healthcare providers are uniquely vulnerable because they are typically not as advanced on their cybersecurity as other verticals, like finance, since healthcare began transitioning to the digital era much later than other verticals. As such, healthcare is more susceptible to cyber attacks, like distributed denial of service and ransomware attacks. Nevertheless, healthcare organizations have a tremendous responsibility to protect patient information. Medical records are high-value targets not just because of their sensitive nature, but also for purposes of identity theft. The medical records of children are especially lucrative on the black market, since the theft likely goes undetected until the child turns 18. Even worse is when medical identification theft is used to obtain medical care. Now the victim can no longer trust that his or her medical information is safe, or that they are receiving accurate medical care. Healthcare is highly regulated, and understanding all of the compliances is extremely complicated. Healthcare or health plan providers, healthcare clearinghouses, and any entity that transmits health or patient information electronically must employ or consult with an expert on these legal regulations. Being out of compliance can be very expensive. Fines can range from just $100 all the way to $1.5 million. Having someone on staff to manage compliance on an ongoing basis is essentially necessary to minimize the organization's risk profile. Some of the requirements a healthcare provider must follow in the event of a cyber attack include having a contingency plan and executing those mitigation steps. The crime must be reported to law enforcement agencies, while the actual threat indications, like the methods used to conduct the attack, must be reported to federal agencies and information sharing and analysis organizations, which is part of the Department of Homeland Security. The provider must also determine if an actual breach of information has occurred, and, if so, then affected individuals must be notified within 60 days of the breach. Considering all of the potentially heavy fines, loss of customer trust, and reporting to government agencies, it makes sense to be proactive instead of reactive when it comes to cybersecurity. Protecting access to the network is a must, starting with an internet gateway firewall. Some basic considerations should also include network address translation, a VPN, and access control lists. Next-generation security features should include a next-gen intrusion prevention system, malware protection, and application control. Web and URL filtering, as well as email spam security, will help deter employees from being directed to and visiting malicious sites. Gateway and endpoint antivirus is a must, and information access management or an access control system is highly recommended. Physical security should also be part of a comprehensive cybersecurity standard. The facility should only be accessible to authorized personnel, and rooms should be secured by doors with punch codes or that require key fobs to unlock. Workstations and other relevant devices should be username and password protected, and IP security cameras should be installed to monitor employee and visitor activity. Thank you for watching.